Sam. Oh, we all have aches and pains at one time or another, but when is the right time to think about getting rehab therapy? Here to talk about this is Hartford Healthcare Rehabilitation Network Regional Director Deborah Canet. Deborah, welcome.
Hi, thank you for having me.
Thanks for being here. So what kind of injuries or conditions bring people to rehab?
Sure. Well, first of all, as we're talking about rehab, what we're referring to is the process where you engage in a physical therapist, occupational therapist, or speech therapist, all whom have an array of expertise in certain aspects of improving strength, mobility, balance, cognition, speech production, and swallowing. So what therapists will typically see a patient for, we're frequently treating muscle strains, ankle sprains. We're seeing sports injuries. We're also working with patients after their surgery. We're also treating neck and back pain, which we saw an uptick in over the last year as COVID really pushed people out of their more ergonomically friendly offices and back into more improvised home settings. Therapists also work very closely with patients and families after stroke or brain injury. And what most people don't realize is that therapists are also treating vertigo, we're treating lymphedema, we're also treating postpartum pelvic pain. And finally, our therapists are very effective in utilizing virtual health as a way to evaluate and treat our patients in the home environment as well as in person.
All right, so what kind of services does the Rehabilitation Network offer?
Well, the Rehabilitation Network is exactly that. It is an immense network of therapists throughout the continuum of care. So what that means is that we've got our therapists in the hospital setting, one of our 7 hospitals, in our inpatient rehab unit, in our skilled nursing facilities, in our vast home care network, and also our outpatient facilities. We also have athletic trainers and exercise physiologists who oversee our fitness programming, but also oversee strength and conditioning of our student athletes in our high schools and our collegiate settings. So what this means is just that it's an integrated system of care where our therapists are able to see our patients wherever they are, when they need us, and regardless of what their plan of care is.
Wow, it's something for everyone. All right, what can a person expect from a first visit to rehab?
In short, you can expect coordinated, collaborative care. And what I mean by this is, for example, throughout our system of care, we use one common electronic medical record system. So what this means is that when you come for your first visit with one of our therapists, we know you. We already have access to information from your physician. We understand already about any procedures you've had, any medical conditions you have, or any medications that you're taking. So this enables us from that first day for your therapist to complete the most well-informed, relevant assessment of you and immediately embark upon working with you and your provider in developing a plan of care so that you can meet your goals.
All right, Deborah Canet with the Hartford Healthcare Rehabilitation Network. Great information. You guys serve everything, it seems like. Thank you.
Yes, thank you for having me.